So sleeping in this position can increase your risk of a blood clot. Did you know that? Like different ways you sleep at night or at a nap can increase your risk. So what can we do to decrease our risk of having a blood clot? Again, I have another video out about things people say before dying of a blood clot. Like you don't want to get a blood clot. No, you don't. And I'll also say, if you're going to have a procedure or surgery coming up, this is why in the hospital we put those weird pneumatic hose things. It kind of is an apparatus that goes around your legs and it pumps air in out because it's getting the circulation going because we don't want you to have a blood clot. And that's why when you go on a long flight on an airplane, I always tell my patients, get up and walk around a lot. Because if you sit there the whole time on that 14-hour flight, you might get a blood clot, especially if you're on an oral hormone like estrogen. Yeah. Okay, so what increases your risk of getting a blood clot by just sleeping or taking a nap? Well, here it is. Here's the first one. The tight fetal position. Now, I'm someone that likes to lay on my side and sometimes on my back, and I'll get in a somewhat loose fetal position, but I know that there's some people that they just ball up in that tight fetal position where their knees are practically hitting their chest and their chin, and they're just all balled up like that. Well, guess what? This compresses the veins in the legs and can increase the risk of blood clots because it restricts circulation, especially if your knees are drawn tightly to your chest. Absolutely. For long periods. Well, if you're sleeping like that, that's a long period because that could go on for hours, right? It's common for side sleepers to sleep like that, but you got to loosen it up a little bit. Yeah, because you don't want your veins compressed throughout the night. You want to be moving a lot. And that's why in the hospital too, with patients that can't move themselves, every 2 hours, we are supposed to turn and reposition them. Reduces risk of a blood clot. And I know some patients and family members get all upset when they're sleeping in the dark room and we walk in there to reposition them. We're doing that so your patient doesn't get a blood clot or your family member doesn't get a blood clot. Yeah. What else increases your risk that you should not do? How about this one? Sleeping on your stomach. I know I had a family member that would always sleep on her stomach. And I'm like, how do you always do that? I'm so uncomfortable sleeping on my stomach. I can't do it. Well, this puts pressure on some key blood vessels in your chest. You don't want to do that because think about it. Your abdomen, your chest, even your arms and legs, it's impeding overall circulation and potentially straining the spine, which indirectly worsens blood pooling. And I can tell you myself, if I slept on my stomach, I wouldn't, but if say someone gave me a medication and didn't turn me, I would wake up with the worst back pain ever. I don't even want to think about it. So if you're taking care of someone, make sure you're turning them every 2 hours if they can't do it themselves, and try not to position them on their stomach. Yeah. Okay, what's another one? Don't ever do this, right? Sleeping upright, like in a seated position or recliner. Now, I know I have patients that have COPD, trouble breathing, they're on oxygen, or they have pneumonia, and the only way they can sleep comfortably is up in a chair. Well, unfortunately, this prolonged sitting position keeps the lower limbs bent and motionless for the most part, because it's really hard to reposition yourself in a chair or a recliner, right? Because this is also going to slow the venous return, like the blood pooling up in your legs needs to go back to your heart. And again, this raises the risk of a DVT, which is deep vein thrombosis or blood clot in the lower leg. Especially when patients are in that recliner. I'm pointing this way because I have a recliner right there. Especially when patients are in there asleep for hours. Yeah, not good, not good. And so I'm really worried about those that have limited mobility, or again, I'll say it during travel, like if they're stuck in a chair and they can't get up, position yourself if you're traveling to be able to get in a chair where you can get up and get out. And don't worry that you're going to disturb the knees or the peace of someone else. You've got to get up and walk around, right? Reduce your risk of a blood clot. So related factors, or I'll say something similar to what we've talked about. So there's other factors that raise the risk of how you're positioned from a blood clot. And that is if you're dehydrated. That's why not really right before bed, but starting in the evening, I mindfully drink a whole glass of water because I hate when I wake up in the middle of the night and I'm so thirsty. That has happened. but I try to avoid it if I can because that does increase your risk. So dehydration, obesity, obesity is technically 30 to 40 pounds over your goal weight or your healthy weight. Yeah, that definitely increases your risk because, again, it's compressing blood vessels. It's impeding good circulation. Obesity, being overweight, despite what you see online, it's not healthy. It does not help circulation. It increases your risk of a blood clot and a cardiac event for sure. Smoking, of course, who doesn't know that by now? But even pregnancy. So think about it. And I know with my two kids, I remember when I was as large as a house, I used to say, because my first one, when he was born, was 10 pounds. I had a huge baby. All that pressure, I was already really short of breath and I could not get comfortable in bed. That could have increased my risk of a blood clot, but I tried to be mindful in repositioning myself frequently, getting up, walking around, putting my feet up, things like that. Yeah. But if someone already has varicose veins or clotting disorders, that does increase the risk as well, for sure. But isn't it interesting to note that just sleeping in a particular way? So now what can we do? Well, one thing you can do is, like I said, moving around. But how about if you're sleeping on your back, raise your legs 4 to 6 inches above your heart using pillows. I do that too. Like if I'm sleeping, I'll put them on my side. I'll put it between my knees because it makes my knees and hips feel better. And if I'm on my back, I put them under my legs too because it helps my lower back pain, but it also helps circulation. That's a really good tip. And it's so easy to do. It doesn't cost any money to do that. But if you just directly sleep on your back, and you're not using pillows, it can actually worsen sleep apnea. Guess what? That increases blood clot risk. Yeah. And it leads to heart strain and abnormal heart rhythms that promote clotting. It also compresses major veins. So if you're like me, a side sleeper and a back sleeper, get those pillows out. Right? I'm over 50, and it's important for me to do these little things because I've already had friends that have passed away from sudden collapse. And this has been since 2020. I have a lot of other thoughts on that, but I'm seeing people in their 50s dying suddenly of cardiac events. And so I think it's really helpful to do preventative things. Yeah. So what else can you do? If you're a side sleeper, don't tightly curl up. Just, stretch your arms out, stretch your legs out. Like I said, put a pillow between your legs. All those things really helpful. Okay. So what are we going to do? We're going to stay hydrated, avoid salty foods before bed, wear compression stockings if you have them, or just, those athletic socks that are kind of tight. Yeah. Now, if you have leg swelling, pain, redness, or shortness of breath, seek help immediately. Yeah. Okay. So hopefully that's helpful to you. How you sleep can avoid your risk of a blood clot. Yeah. So thanks for being here, and I'll see you on the next one.